Welcome, everyone, and thank you for joining another virtual presentation as a part of our 2021 Global Health Leaders Conference at Johns Hopkins University. Today, we are very happy to have Dr. Traci Wolbrink at our conference. To briefly introduce Dr. Wolbrink, she is a senior associate in critical care medicine in the Department of Anesthesiology, Critical Care, and Pain Medicine at Boston Children's Hospital, an associate professor of anesthesia at Harvard Medical School, and co-director of OPENPediatrics, an innovative web-based educational platform through which healthcare providers caring for critically ill children globally can learn basic or advanced skills. Dr. Wolbrink, we're very grateful to have you at the conference today. You can feel free to begin your talk whenever you're ready.
Wonderful. Thank you so much for the invitation. And I'm really excited to be here with all of you this evening. And I encourage you to post anything in the chat and we'll sort of answer those. And I look forward to having some discussion with you afterwards. So I'm just going to share my screen. I wanted to just, start out by, a way of sort of introducing you a little bit to what I plan to talk about today. And I was hoping to share a little bit of my journey into medicine, global health, and public health, which I know all of you are excited in one way or another to those three topics, and just share one pathway forward with having a career in those fields. And so my interest really lied with education and global health, and I was trying to figure out a way to bring that together along with my interest and love for staying in Boston at a hospital that I love working at. And so how could I combine all of those efforts while still working here? And so I'm going to share with you a little bit of the story of how we designed and developed OPENPediatrics. And you'll probably see this is a pretty big program, and I'll share with you acknowledgements at the end, but this was the labor of love of lots and lots of people. All right, so to begin, I work at Boston Children's Hospital, which is a quaternary care facility, and I work in the intensive care unit. And one of the things that I discovered when I got there was that it was an incredible place to work and an incredible place to train with some of the smartest minds and really collaborative teamwork. And it was a wonderful place to be. And I used to direct the International Observer Program, where students would, and residents and fellows would email and ask if they could come and join us in the hospital to spend a few weeks or a month just shadowing us. And you can probably see here is a picture of one of my colleagues, Dr. Graham, teaching on rounds in the morning. So there are some residents there. We have some consultants. And in the background, there's a gentleman with a white tie that was one of our international observers. And these observers would come and they would just stand and listen on rounds and absorb all of the education that was happening that day. Now, what I found to be a little bit disheartening was the fact that I could only accept about 25% of the people that applied. And so there were a lot more people that wanted to come that couldn't. And they just wanted to be inside these walls and learn from these really great teachers. And so we were really trying hard to think about how do we scale this education and how we can bring this more broadly to more people. Because what I was lucky to have in the hospital was really, really innovative training experiences. This is an example of a simulation with a whole full team. We've got nurses, doctors, social workers, all of these clinicians coming together to take care of a mannequin-based patient. And this was wonderful. But again, these tools were not scalable. We couldn't bring people in unless they were inside the walls. So we wanted to think about a way to transform this. And if I could sort of say, this was around 2007. So this was quite a while ago, before all the technologies that we really have readily available at our fingertips now. And so if you can imagine trying to do this right when YouTube and Twitter and all of those were just starting was a little bit more challenging. And so this is the environment where I work. And as you can see on the left-hand screen, this is a picture of a little baby that's underneath that blue drape on the left. And this patient's on a machine called ECMO, which takes the blood from the baby and puts it through this machine and gives it good oxygen and takes out the carbon dioxide and breathes for the baby, and can also pump blood like a heart. And so, pretty complicated technology. And as you look in this room, it's probably pretty crazy, right? It's hard to sort out what's going on. There's all these machines that this patient is connected to, all this monitoring. And, it's really quite an intensive place. And on the right-hand side, you see we have these giant teams that are in there. This is an example of actually doing surgery in one of the rooms. And we have an incredible transport team. And so we started to think about how to scale education and knowledge outside of the walls. We had a lot of people that said to us, what are you doing? You can't scale the knowledge in a location that looks like this out to places in Africa, and other lower resource environments. What you're trying to do is a little bit crazy. They don't have the same sort of resources or the same sort of need. So I wanted to prove them wrong. So I started going around and just looking at other pediatric ICUs around the world. So I went and I spent some time in Cambodia. This is a patient that we cared for there that was receiving heart surgery. And I sort of challenge you to say that, doesn't this look pretty similar to the environment that I work at? This patient's connected to tons and tons of tubes and lines. It's pretty complicated. There's a whole lot of medicine. There's a whole lot of monitoring. And I felt, there's a lot of things that we can teach each other as we sort of think about this. And so, I thought that we were more similar than different as I did some of these travels. And then when I spent some time in Bangladesh, and this is an intensive care unit that they just opened up for both adults and babies. And again, you can see a really incredible team with wonderful resources that were able to provide excellent care. And this again is another picture from Cambodia of transport, so it may not have necessarily our fancy ambulances, but still, how do you get patients safely to the hospital when they need it? So I thought that, we should at least give it a try, because there's probably a lot more similarities than we think. And then also in my travels, I learned that actually in a lot of these places, there was a bunch of innovation that was going on that I didn't even know about. So on the left-hand side, this is a picture of a little baby in Malawi. And when I arrived in Malawi, I was working in an HIV hospital, but a lot of their patients weren't dying from HIV because they had access to HIV medications. What they were dying from is things like pneumonia, which, we can pretty easily treat with antibiotics and oxygen therapy. And I had just been in Cambodia not long before that. And the Cambodians were using this really cool device called bubble CPAP, where they took an oxygen source, they connected with some tubing, and then I don't know if you can see in this top corner up here, there's a water bottle and there's this tube stuck into it about 5 centimeters below the top of the water. And that creates some pressure, which helps to keep the baby's lung open. And the doctors and nurses in Cambodia actually found that they could prevent half of the kids from needing to be on a breathing machine if they use this device. And I had never used this because, we have a bit more fancy equipment in my hospital. But, when I got to Malawi, I thought, this would work really well. And so I spent a couple of days kind of trying to find the equipment in the hospital, everything I could find right there. And we connected this first baby who came in. Their oxygen levels were about 50% when the baby arrived. We put the baby on CPAP, and within 5 minutes, the oxygen levels rose to 98%, which was unbelievable. And I thought to myself, I learned this technique in Cambodia. I'm not an expert in it. The Cambodians should be talking to the Malawian clinicians and actually sharing their innovative knowledge. And so trying to really think about a platform or a forum that we could share these really cool innovations, because no one hospital has all the answers. And so that really inspired me to not only think about, online learning in terms of videos, but really developing out a social learning platform for people and clinicians to share these bright ideas. And on the right-hand side was a bed in Bangladesh. And I felt a little silly, but I had to ask them, why is there this hole in your bed? Like, why are the patients lying on these beds with holes? And that was because they saw a lot of cholera in Bangladesh. And the patients that had cholera just had such watery, profuse diarrhea that they would just let the patients have diarrhea, and then it would just go down the bed and they would collect it in those buckets below. And I learned so much about the differences in types of diarrheal diseases at this hospital, which was called ICDDRB. And they were truly experts in diarrheal management. They are able to take care of like 300 patients in their slow season and flex up to 1,200 patients during the middle of cholera season. And so this team was absolutely unbelievable in terms of flexing their capacity, also getting IV access on some of these patients that were so dehydrated. And it was really remarkable to see what they were able to accomplish. So I would say I learned as much from them as hopefully I were able to share with them while I was there. there. So this was a really wonderful learning experience for me. And then when I came back after sort of visiting all of these places and thinking about what do we want to do, I started thinking, well, if we really want to make a way for clinicians to connect to each other and not just build, one way, one person sort of giving all the answers, how can we do it? And as I mentioned before, this was in 2007, 2008, and all of these social media tools like Skype and YouTube and Twitter, Facebook, WhatsApp were all just being developed and weren't that readily accessible or heavily used by healthcare professionals in general. And so we wanted to think about, all right, where do we go? How can we build out social collaboration? Because this was just starting to emerge as a thing. And so lesson number one, I'm going to sort of go through 10 lessons that I learned. Hopefully some of these might resonate with you. But these were the lessons that as I look back on the last 14, 15 years, some of the things that I think were keys to being successful. And the first one was doing my research. So not thinking that I had all the answers. And part of it was going and visiting places and asking clinicians, what do they want and what are they seeing? And then the other part was sort of looking online and sort of talking to other people. So these were just a few of the resources that we took for inspiration. For example, if any of you are aware of MIT OpenCourseWare, this was one of the first OpenCourseWare sites, and MIT decided to put all of their courses online and really give free access to everything to anyone around the world. And we were fortunate to work with Steve Carson, who is one of the founding members of MIT Courseware. And he shared with us tons of stories about, people in rural villages that watched the courses on how to bring electricity to their village, and, just some really, really incredible ways that these online free resources were utilized. So we certainly loved that mission and decided to adopt that for OPENPediatrics. And then we were very interested in other large courses like edX and Coursera, which were popular at the time. We took inspiration from other online learning platforms like the Rosetta Stone and Ruby, which is this really cool cooking platform at that time. We also looked at the Khan Academy, which I hope probably many of you are familiar with. Sad to say, Wikipedia had just started around that time. And I think YouTube, I believe it started in 2005 or 6. So there was, hundreds, maybe thousands at that time of videos, but really not many. And so, we started thinking about these platforms and open sharing of learning. And then we also wanted to think about more innovative ways than just video or text. Text was probably the main format of delivery of education at that time. And so we looked at the bottom left-hand corner. This is a flight simulator in the airline industry. They were doing really cool work by putting their pilots through simulations a couple times a year where they'd have to go in and fly planes under emergency situations. So they were really practicing just like we would do, for the orchestra or for a sports activity. And, the Department of Defense up in the right-hand corner, this almost looks like a picture, but this was one of their simulations, and they had to train people all across the world to do really complicated missions. And we thought that this would be very similar. These high-risk, low-frequency events that they were training for were very similar to the kinds of things that we were training for in medicine. And we also thought about our students, children, brothers and sisters, colleagues that were playing video games and were able to talk to their colleagues around the world. And we thought, wow, we can talk with video games to people, but we can't actually talk as clinicians and professionals. And so we thought that there had to be a better way to kind of work on our communication. So around 2010, we also kind of felt like we were on the same line because Julio Frank, who is the dean of the Harvard School of Public Health, led a commission in the Lancet looking at health profession education, nursing school, medical schools, and public health schools. And they really came up with the concept and really emphasized that we need to share using technology. And if we can share resources more freely, we can really level the playing field. And no matter what country you are born in, no matter what country you go to school in, you can actually learn from the best teachers and the best educators. And so we were super excited because that was what we were really, really planning on doing. And so we felt like we were being really supported by what a lot of really great minds were thinking. So we came up with this idea, right? So how can we scale all the knowledge inside of a hospital and try to get people to communicate with each other? And how are we going to do it? So we were a little bit stuck as to where to begin. And so my mentor and partner in this project, Dr. Jeffrey Burns, really loves golf. And so he was watching the Masters golf tournament one day, and he came across this website. This website probably looks super old and pretty crazy by now because this was 2009. But what he saw was this really cool website that was built on adult learning theory and best practices in the adult learning and online learning. So you had an experience with watching, I guess this is Angel Cabrera is what it says there. I don't watch golf, so I really don't know a lot of these players, win this tournament. And then you sort of see him explain how he was able to putt and what were some keys to his success. And then there was a community where people were talking about it and sort of congratulating this player and sort of thinking about ways that they could probably do this themselves. And then there was an opportunity that you could go in and practice putting on some of these greens. And all of this sort of brought to life what's called the Kolb learning cycle. And this really sort of takes learners through this cycle over and over. And we wanted to design something exactly like this for our website. And so my next lesson is be bold, so I probably would have said, oh, well, let's think about how to do this on our own. Whereas my boss, who's the chief of critical care at Harvard, said, I'm just going to call these guys and have them come to my office and ask them to do this for free for us. And I said, all right, let's see how this goes. So he called them. This turned out to be a website that was designed by a company, IBM Interactive. I'm sure you guys probably know IBM, but one of their really innovative companies or subsidiaries is called IBM Interactive. And they happen to be one office was in Cambridge. And so we invited them to come over to our hospital. We shared with them what our problem was, and we asked them to help. And they said, sure, yeah, that sounds good. Sounds like something we would be interested in doing. So we partnered with them. And I, as I was doing my critical care fellowship at the time, and I would go and spend 2 or 3 days a week with them at their office in Cambridge, and we worked on designing a platform. And our first platform was here. It's a little bit grainy, as you can see, and it was built on a platform called Adobe Air, which doesn't even exist anymore. But the super cool thing about this platform is that we said the problem, back in 2008 was that not a lot of places had good internet access. And so we needed something that could work whether you were connected to the internet or not. And that was our challenge to them. And what they built was this platform that would be able to be passed along on a thumb drive and could be downloaded on a computer. And if you had connection to the internet, it would send your score reports or download new content if you had internet access. And if not, you could do everything offline, which was really cool. And so this platform, which we called Amphitheater, was our first attempt at a social learning software. And, we had a lot of iterations of this platform as we went forward, but I think this one was really, really cool in that it worked in low bandwidth areas. It allowed us to have the collaboration, videos, and a bunch of our really interactive games and tools. And I apologize, my mouse is creating a little ruckus tonight, so my apologies for that. All right, lesson number 4, don't be afraid to fail. I had a lot of time where I went through a lot of failures on this platform, and I just kept going. So the first thing was I had to learn how to edit videos. I'm a doctor. Unlike probably many of you who probably have edited lots of videos, there was no iMovie at the time. Our phones barely had a camera. And so when I started, it was a little bit nerve-wracking. And so I had to watch a lot of YouTube videos to learn how to use some of these video editing software programs. And my mentor also, we had a bunch of administrative staff in our unit, and there was one woman, Joanna Mello, who was really excited about this project. And so she and I partnered, and we learned how to film and edit. And this video, I picked this one in particular because my face looks really disheartened. I think that was the 6th time I was filming this video on how to set up bubble CPAP. And we kept getting it wrong. We kept having poor lighting. We kept having the wrong sound. And it took us a lot of versions before we got the first video up and running. And she would always make me wear the same outfit every single time. So we had a lot of fun as we were filming that, and we learned a ton as we went along. And then we thought about, okay, so we're getting started, we're making some videos, we are working on a platform. What are we going to call ourselves? And so thinking about what's your brand? What's your mission? What are we all about was one of the things that we had to think about before we launched. And so our first idea was a mouthful. Pick You Without Walls was originally one of the names that we were thinking of. And it's a little bit probably hard to read, but we were looking at all the domain names that were available at that time. And ultimately we settled on OPENPediatrics, partly because it wasn't critical care specific, and it was probably easier to say than Pick You Without Walls. But that took us a little bit of time to even come up with our name and what we wanted to be part of. And my apologies for this mouse. So then next step, now you've got to test and iterate, and you've got to keep working at it and keep figuring out how to do things better. So I shared with you before the first platform. This was our second one. Looks a little bit prettier. It had a little bit more ideas of exactly what you could do on the platform, and we worked out some of the kinks and the bugs. And then what I did was I took this platform, and you can see this was, again, going back to the same hospital in Cambodia that I had visited before, because I promised to come back with something for them. And so I came back with this platform, and we tested it in Cambodia to see if it would work on the internet, to see if the team there found it useful. I actually recorded them as they were using it. I then traveled to a whole bunch of places asking people to test it and give us feedback. And with all of that, we took it back and we refined and we revised things. We revised how we were making our videos, especially as we were thinking about both English and non-English speaking clinicians. And then the next step is to create enthusiasm for your program or your project, because we wanted people to use this. We had spent this was going on 5 years to get this platform up and running and ready for its release. And so we wanted people to be as excited about it as we were. So we created the first launch was in September 2012, and this was by invitation only. And we were really hoping that we would get 10 countries to use it, and IBM said that we could have 1,000 users and no more. Otherwise, they were worried that our servers would crash. And so as you can see here, as the year went on, we very quickly went to more than 60 countries, and we very quickly were rising in our users, and we were quickly approaching our limit. And thankfully, IBM just kept letting us have more and more users as we built enthusiasm. And as you can see right away, within the first year, we had people using this platform from all over the world. And it was really exciting to see this enthusiasm being generated. And once we launched the platform formally and moved to a web-based platform, as you can probably tell from this, we began to sort of emphasize our success and describe, who was using it, what awards we were winning, and sort of continue to drum up enthusiasm for the content. But I would say the biggest way that we were successful was identifying those champions, people that found this useful to use and figure out why they were excited about this platform. And so you can read here a few of these quotes, and we saw some really, really amazing things coming out. The gentleman on the upper left-hand corner is Dr. Itai Pesach from Israel. And he just found our platform incredibly useful and had all of his residents use the platform. And he came to visit us once in Boston and basically came and sat down with one of my medical animators and said to her, "Do you know what you did last week?" And she sort of looked up at him and was a little bit confused, because she was saying, I was sitting at my desk drawing, probably like I do every day. And he said, "No, I had a resident last week who had watched one of your videos, and specifically one of the animations that you created about how to use a mask to sort of put on the baby's mouth and sort of squeeze a bag and give them breaths. And they went to a delivery, and a baby came out and the baby wasn't breathing. And so they tried to give this baby some breaths with this mask, and they weren't able to see the baby's chest move. There was no air going in, and they couldn't figure out. So they kept changing lots of different things, and nothing was working, and this baby was dying. And then this resident remembered your animation about this valve that you have to occlude and shut, and so you can deliver higher pressures. And so this resident did that, and they were able to deliver a breath to the baby, and then the baby started breathing on their own, and the baby lived. And it was because of this animation that was burned into his mind after watching this video. And so I think that was just a beautiful example of the power of some of this training. And you don't realize how many people you might reach with what you're doing. And it was that story that I think, really touched us. And as you can see here, there is a lot of really amazing quotes. One other one I think that really hit hard with us was the one on the bottom in the dark color from Chile. We were talking with a Chilean clinician, and he said that he used to being at the very tip of Chile. He was at the very, very tip of the country, near Antarctica, and said he used to lie awake at nighttime thinking about the fact that he was so far away and that he felt disconnected from the rest of the world and what the rest of the world was doing in their ICUs, and wondering if he was delivering the best care. And by joining OPENPediatrics and seeing what people were posting and how people were talking about medicine, said that he thought that it made him feel included in our community, and he didn't feel isolated anymore. He felt connected, and he really realized he was doing a great job with his patients. And he actually said to us that he found he could sleep better at night because he wasn't so worried about his patients and if he was providing the best care. And that was just an incredible story to hear, because we had hoped we were impacting clinicians and we were impacting practice, but each one of these really reinforced that we were on the right track. And then there were a lot of things that were coming. One of the residents that had used our ventilator game, which I'll share with you a little bit in a few minutes, said that he had been practicing on the ventilator, but then was able to use this in his own practice. And actually the fidelity of the simulators or this ventilator was so real that he was able to apply the lessons learned and fix a problem. So although we weren't able to do a randomized controlled study and really investigate exactly the impact of this, we were seeing these messages come across that really encouraged us to keep going. And these champions really were crucial to our success. And then, like I said, I think this mouse has a mind of its own tonight. The next step is to think about, as with your project, how are you going to define success? And I just shared with you some examples that we use to define success. And these were the stories that we were getting, that we were understanding how clinicians were using the platform and how patient care was being impacted. But then we also needed to appeal to people that wanted to see numbers. So in addition to that, we looked at, one was global reach. Our mission really was to try to figure out how we scale the platform. And so we looked at how many countries were we hitting. And I'm proud to say that we are in every single country around the world and have been so for several years. And the graph on the right-hand side shows our website users. So we've far exceeded this now. This was as of last October. We had 65,000 healthcare professionals on the site. I think we're surpassed about 80,000 at present. So if you think about the very small world that I live in, which is pediatrics, that's a lot of healthcare professionals that are using this website. So the uptake of this has just been remarkable to see. And this is just of our website itself. We also publish all of our videos on YouTube, and we have podcasts that are available through all the podcasting domains. So that's another form that we use. And so we looked at what we call our content engagement. We look at to see how many people watch our videos on YouTube, how many people listen to our podcasts, how many people visit our site. And as you can see here, we get close to around 400,000 views per month. As you can see in April and May, when the COVID pandemic hit and people quickly transformed to online learning, shifted there, we had a huge uptake in our videos. And a lot of that was related to COVID content. And I'll share with you what we did with our mechanical ventilation simulator in just a moment. We also do a lot of work on social media, and you can see here in April, again, this is a big spike because of COVID. As many of you probably can remember, there were a lot of people in April that were really scared because so many people were dying of breathing problems. And one of the only ways that we had to, think about saving them at that time was by using all the breathing machines or the ventilators. And so what we did was we created used our mechanical ventilation simulator and created COVID cases to train doctors and nurses that might not have been using a ventilator in a while, or maybe had never used a ventilator, to train them how to use a ventilator properly to take care of these patients. And then we also made cases that were specific to COVID, so that those practitioners that had never treated COVID before could practice first on our simulator before they were taking care of real patients. And you can see here hundreds of thousands, 1.5 million people actually engaged with our ventilator on social media. So that was a huge spike there. And what the ventilator simulator looks like is this, and this is our COVID case. And so what we built basically functions on your iPad or your tablet or your computer, and it works just like any other breathing machine around the world. And you can adjust the knobs and dials, you can examine a patient, you can look at their vital signs like their heart rate and their oxygen. And you can do a whole bunch of different interventions to the patient, like give them various medications and other things. And this is one of our really exciting offerings that we have in OPENPediatrics. And it really incorporates all the best learning from game design, adult learning theory, motivation, some concepts like we call mastery learning. So you have to master a topic before you move on to the next level. And another concept called deliberate practice, which means you practice over and over till you get really good, and then you're able to be a master at that. And so I'm going to share with you a really short video that kind of explains a little bit of the history as to why we chose mechanical ventilation as our first one of these games. So, and I'm just going to play this video here for you.
So we had a physician come to us who was working in Yemen, and he said that he had a problem because he had a lot of kids that were dying of respiratory problems. He had a room full of ventilators, which could potentially save these kids' lives. But the doctors and nurses there didn't know how to use them, and when they tried, they actually caused more harm, and a lot of the patients died. They felt that these machines were black boxes that they just didn't understand and they didn't know how to use, and therefore were afraid to use them. We thought, well, there's got to be a better way than simple videos or the gold standard, which is reading a manual, and really tried to create something that was very interactive and exciting and would allow these providers a chance to practice saving patients' lives on the computer before they had to do that in real life. So our goal was to give them these opportunities to improve their skills and then translate that into real patient care.
So I'll just pause here. And that's why we began with the ventilator. We heard over and over, this clinician from Yemen came to us and told us this story that, was just heartbreaking to see this room full of ventilators not being used and children dying that didn't need to. And in my experience with traveling to lots of the countries that I already shared with you, I was seeing that 100% of the patients that were put on breathing machines were dying because clinicians didn't know how to adjust the knobs and the dials, and partly because there wasn't any training. There might have been a manual, but they oftentimes didn't explain like the real details of how to use these machines. I mean, my training was 3 years in critical care medicine. The majority of that was spent learning how to use this machine. And so how can you translate that knowledge by just reading a manual? And so we thought we really need to figure out something that's going to be more interactive, more engaging, and super exciting for people to use. And so that's why we went to work creating the mechanical ventilation simulator. And this is what it looks like. And we did a study of this, which I'm going to share with you some of the results. But we also, once we did this simulator, we also thought about what are some other tools that people are using, or devices that people are using around the world that they might need to learn. And so we thought about dialysis. And there's a couple of different ways to deliver dialysis. And this one here is called peritoneal dialysis, which is where you can basically infuse some fluid into a baby's belly and then drain that fluid out. And with that, you basically function like a kidney. And this kind of dialysis can be done in many locations with really, really low cost technology. And so our goal here was to train clinicians in the concepts of dialysis. So no matter what tubing you had, no matter what catheter you had, no matter what salt solution you had, you could figure out the right way to do dialysis. And when we looked at this, we deployed this, and we saw clinicians all around the world using this simulator. I think in our study that we looked at a few years ago, we had like 65 different countries were using the simulator. And we have a nursing school in South Korea that loves these simulators, and they will host every year that their students are there, they will host competitions on the weekends and have their nursing students use the ventilation simulator, the peritoneal dialysis simulator, and I'll show you our hemodialysis simulator. And they have competitions on who can score the highest. And they've asked us to record basically congratulation videos for the winners of these simulators, and have actually translated some of these simulators into Korean for us, which has been really amazing. And then we also built what's called our hemodialysis simulator, which is basically doing dialysis by filtering the blood. And this project, we won the American Society of Nephrology Innovations in Kidney Education contest because of the way that we were able to train that was really kind of creative, which we were incredibly excited to see. And so we wanted to dive in a little bit deeper, and I'm not going to go terribly crazy on the research, but as a physician, I sometimes do like to think about that. So I'm going to share a little bit of that with you right here. And so we did a study where we called it the Game-Based Education in Residency, or the GAMER study. And you probably can't see this terribly well, but what we did was we asked residents, and these residents were at 33 hospitals in 8 different countries. And they were rotating through the pediatric intensive care unit where I work. And we asked them to either do the mechanical ventilation, this breathing machine simulator, before they worked in the ICU or after they worked in the ICU. And we were able to compare. Originally, we tested them on their first day and before they used this game. And then we tested them afterwards. And what we found was that if they used the game for 5.5 hours, they learned as much about how to treat kids on breathing machines as students spent an entire month working in the intensive care unit. They had the same amount of knowledge from 5 hours on the game versus a whole month working in an intensive care unit, which was pretty exciting if you think about it. It is really efficient. And, we could probably, which the goal of the study is going to show, maybe if we gave it to them ahead of time, maybe they could learn more. That was sort of our hypothesis. And then what we did was we gave them 2 months off. We gave them a 2-month break from thinking about mechanical ventilation, and we tested them again. And what we found were the students that had used the game actually retained more of their knowledge on how to take care of these patients than those that worked in the ICU for a month, which is pretty surprising because, most of us think that by working in the hospital, that's the gold standard, that's the best it gets. But this kind of showed us that maybe there's some really cool creative ways that we can think about that might transform the way that we're training doctors and nurses. And as you can see here, unlike when we were using a mannequin, this can be scaled all across the world, and people can use this simulator if they've got a phone, a computer, or another device. So then we tested the students again and had them do the other. So if they played the game first, they went into the ICU rotation. And if they worked in the ICU, they did the game afterwards. And we found the students that used the game first ended up learning double. So what this showed us was that if we can give some really exciting educational tools beforehand, students probably are going to learn more. And we're actually thinking about how to do this in the clinical environment before every rotation. But obviously that's going to take a little bit of time to completely transform how we're thinking about residency. But I think this is some really great opportunity here. And I just wanted to show you a few of the hospitals and programs that are using OPENPediatrics. We are so humbled that we receive pictures very often of people that say, I've been using, on the far left-hand side, this is one of the hospitals in the Middle East, and they actually pull up OPENPediatrics on rounds and show different teaching videos and use this as an example to teach about their patients. And you can see here, this interdisciplinary group stands around together and sort of learns together on the job. And then the picture in the middle with the banner is the nursing school I was describing that loves our simulators. And so they sent us this banner thanking us for making those. And then there's some other hospitals from, I think the right-hand corner on the bottom is from Spain, and the other two are from Cambodia. And so we very frequently and very often receive these pictures, which are wonderful. And as I mentioned before, I am sure that I'm forgetting some names here, but this is a list of all of the doctors, all of the pre-medical students, all of the medical students, all of the residents, the fellows, our OPENPediatrics staff members, our videographers, our game developers, our animators, and everybody that has worked with us in a major capacity. There are probably hundreds and thousands more names that I could put here of people that have contributed as authors or peer reviewers. But this is the work of a giant team. And that's one of the things that I love most about this project is it's really a collaborative environment, and we're all about how can we design things that ultimately improve the care of sick children around the world. So I'm going to stop here.
Thank you so much for sharing your story, incredible work, and some very valuable lessons, Dr. Wolbrink. Yes, we'll now shift to our question and answer session. Students, if you do have any questions or thoughts to share, please use the raise hand function if you're able. Turn on your camera if possible, and I will call on you based off the order you appear on my Zoom. Before you ask your question, please do let Dr. Wolbrink know what grade you're in and where you're from. I think first we will go to Shrika, and let me make sure you're unable to unmute yourself. There we go.
Hello, my name is Shrika and I'm a freshman from Northern Virginia. And my question was, what inspired you to go into pediatrics and like work so much in that field?
That's a great question. I think, what inspired me the most, so I did my residency training in both internal medicine and pediatrics. So I took care of adults for 4 months and then kids for 4 months and then adults. And that's how I worked through those 4 years. And what I loved about pediatrics is that kids just got better. There were so many diseases of adults that were caused by their lifestyle choices and other things. And in kids, they're just, no matter how sick they were, they would give you a smile. And every day it was just really rewarding to go into work. And you never sort of questioned how hard you would try and how much you would try to push the envelope as much as you possibly could. And I will tell you, one of the most rewarding things, I had a patient who was having seizures, and we weren't sure if this child would survive, and they ended up pulling through, and it was really wonderful. And about 3 months later, I got a call that said, Dr. Wolbrink, can you come to the front desk? And I walked out there, and this little boy walks up to me and gives me a high five. And it was that little boy that had all the seizures. And I just thought to myself, this is why I do my job. These kids are so unbelievable, and they get better, and they just have their whole life ahead of them. And so I think that was probably my biggest inspiration for going into pediatrics.
Thank you. Next, we can go to Gemma.
Hello, thank you so much for this presentation. I'm a sophomore from New York City. I wanted to ask, what challenges did you experience in guaranteeing that knowledge from the simulation environment would translate into a practical application? How did you manufacture that experience?
That is an excellent question. So we took a lot of inspiration from the gaming world. And so we read a lot about some of the game theories and game design. And we hired a company that spent a lot of work thinking about marketing and apps and game development. And so together we came up with a process where we invited them over to the hospital, and we walked them through exactly what we did on our everyday. So for example, for kids on a breathing machine, myself and several of my colleagues, we said, all right, as soon as I walk into a room, this is what I think about, this is what I do. They took tons of pictures and videos. And then together we designed the environment that would incorporate all of the things that we needed to do our jobs, but not a lot of extraneous materials. And we built this using game theory. So we decided to start with some easy things. We would train our clinicians on how to use the ventilator. And we would then give them harder and harder cases with less and less hints over time. And then we hoped that it would work. because we adhered to good practice, but then we studied it. So we had people come and use it. And then we looked, as you could see, you know, as I explained with the gamer study, we started to look to see, did this translate into clinical practice or not? And could they improve their knowledge? And so I think by adhering to really good instructional design and incorporating really smart people that were thinking about this every day, I think what we've done is we've built some things that are really worthwhile.
Hello, Dr. Wolbrink. Thank you for your presentation. My name is Han Jung, and I'm in I just finished 11th grade, and I'm in South Korea. Earlier you mentioned that when you first started the OPENPediatrics, you had to make and edit the videos, and there's a lot of trial and error involved. Yeah. And I was wondering, what are the most important lessons or things you learned from that experience?
Yeah. I think, you know, one of the things that I learned was just keep going. You know, I spent a lot of hours and I got better over time. And I loved it. And, you know, my boss always says to me, pick something that you love doing, because then it will never feel like work. And so every day do something you want to do. And I just found I like to be very creative. And so I was able to use my scientific part of my brain and my creative brain to do something. And with that, even though I was putting a lot of hours in, it didn't really seem like it was a chore. And I'm sure if I look back at the early videos that I made versus what my team now, which is fully trained videographers that know how to do things, they're quite different. And my team is way better now than I was. But I would say, don't be afraid. Perfect is the enemy of the good. And just by putting something out there was more than what was available at the time. We knew we would get better over time, but we had to start somewhere. So start somewhere and do the best that you can, and bring in some really important people that can make sure you're not making big mistakes, and then just go with it.
Thank you.
You're welcome.
Thanks. Next, I see Kane.
Thank you. Thank you so much, Dr. Wolbrink, for the great presentation. I really found it quite interesting. And I think personally myself, I have a few ideas to somewhat have this combination of software and the medical field. And that's something I do want to pursue in the future. What would you really advise? Like, obviously, I just mentioned I want to somehow combine those two fields. What would you advise on the best way to somehow, would you say go on a more software route and then get some pre-med experience, or would you say go on a medical route and then get some software experience? What would you say is the best route to somehow do what you did in a somewhat similar fashion?
Yeah, it's a great question. And I think, you know, you probably have to stop and think for yourself, you know, what's the thing that drives you the most to it? Is it the software or is it the medicine? And whichever one is the one that I always think, what would be your biggest regret? So if you wanted to do both, but you're only able to get through the first one, which one is really your heart's desire? And maybe start with that one. And then, you know, when you get there, you know, one of the other things too is to ask other people and, you know, get some experience in both fields, because what you might find is that one or the other might fit your personality better or be in the domain that you want. You know, I can share, I have a lot of different team members on my team. I have one person right now who is interested and really thought that she would go into speech pathology, but then decided that she didn't want to work in the clinical environment, but wanted to help in a different way. And so now she's one of our instructional designers and works on software. And so by finding out and having some work experience, I think you'll probably figure out where your passion lies and which one to start with first. You'll have a great impact either way.
Thank you.
Yeah.
Great advice. Next, I think we can go to Abby.
Hi, I'm Abby Ghleva, a rising sophomore from the Philadelphia area. And my question was, how do you hope the simulation will be incorporated into hospitals' everyday routines, not just in pediatrics, but throughout all specialties?
That's excellent. One of the new simulators that we're working on is a simulator for, do you remember the ECMO machine that I showed in the beginning, the heart-lung bypass machine? And I will say that that is a technology that's emerging and really, really exploding in the adult world. So it's not just used in kids. And that one, we are thinking right now about how best to deliver that training more globally. And so I think what we're planning on doing is a lot of hospitals are thinking about how can I quickly train all of my clinicians to use this new technology. And so I think there's not another game like this out there. And I think as compared to videos or in-person training, we may have an advantage that people will want to use this because it's fun, it's easy, and it's really scalable. And so I think that that's probably the area where we're going to be able to spread into the adult world a little bit more. We also are building an adult version of the ventilation simulator. Right now, it's just pediatric cases. So I think once that gets delivered, will probably be even more useful in the adults. But I will say what we saw with COVID was that a lot of adult providers were using the adult cases that we built that were COVID related. So I think if you figure out where a gap is and find a way to replace that, then you will be successful in getting into these markets that you really want to get into. And I hope that that's where we've gone with our simulators.
Thank you.
You're welcome. Great questions. You guys are asking really amazing questions.
Next, we can go to a question in the chat from Bridget. She asked, were there any major struggles you faced with OPENPediatrics after it launched?
Oh, how many hours do we have to talk? There were a lot of struggles. And I think, one of the first ones I mentioned to you was the internet access. That was a huge burden, which is only getting better every year, but we still do struggle with that. I think another thing we struggle with is awareness. We think a lot of people know about us, and we've been spreading really slowly, but we've been spreading mostly by word of mouth. And there still are people where I'll go to a conference and, someone doesn't know OPENPediatrics, and it's surprising to me because we have a lot of content. And so I would say another struggle is how do we make people aware of the good content and figure out, how can people use it? One thing that has come up a lot is that people say, well, your content's really good, but it's not exactly specific in the way that my hospital uses it. And so that was another struggle. How do you make content that is relevant to so many different hospitals with different ways of doing things? And I don't think we've perfected that answer yet. We try to pick out content that no matter what country you're in or what hospital you're working at, that the content is relevant, but that's still another domain that's a little bit hard. So those are probably our biggest struggles, but I'm sure I can think of a lot more.
Thank you. Next, we have one question from Alex, who asks, when did you start to have a passion for pediatrics?
That's a good question too. I think probably for as long as I can remember, honestly, I wanted to be a teacher originally. That's what I thought I was going to do. And then probably like all of you, when I was in high school, I changed my mind and I really found medicine to be really interesting. I was an athletic trainer in high school. So I used to work taping ankles for, a lot of the teams, and I was an athlete myself. And so I really loved that medicine element. And once I started actually in medical school and sort of rotating through the different specialties, I really found pediatrics to be probably my favorite. And so ended up going into that domain. But I think I always loved working with kids and wanted to teach in some way and wanted to help. So that kind of has been consistent throughout my whole life as long as I can remember.
Hi, Dr. Wolbrink. Thank you so much for the wonderful presentation. My name is Nandika. I'm an incoming junior in Fremont, California. And my question was just, how did you take that idea that you had and apply it and actually make it into something that was feasible? What was that process like?
Well, that was a long journey. I think if you would have asked me when we were getting started, if I thought this would be where this program was today, I probably wouldn't have believed that it would be. And I think I was incredibly fortunate by being surrounded by really wonderful people that opened a lot of doors. I've talked a little bit about my mentor and colleague and partner, Dr. Jeff Burns. And we had just people that believed in our mission throughout. As I mentioned, IBM and this other company that helped us with our games, Genuine Interactive. And we have so many advisors and different people that really believed in us and opened a lot of doors for us. And I think taking that and also just being hardworking and not quitting and just keep pushing through and finding innovative ways and getting people to follow you, I would say was the way that we were able to really get this off the ground. I think there were a lot of opportunities where we could have easily quit, but we really just kept going and really felt that our mission was so important that we couldn't stop. And so many people believed in us and helped us along the way. And I think that was crucial to our success.
Hi, my name is Kaylin Morris, and I'm a rising senior in Charleston, South Carolina. And I was wondering if there was any chance in the future that a site such as OPENPediatrics would be available for student use, those like interested in pediatrics or other careers in medicine.
Yeah. And actually right now you can go to YouTube and you can go to our YouTube channel and you can subscribe and you can see any of those videos. And honestly, you can go to OPENPediatrics and you can register for an account now if you'd like. And if you want to kind of play around and use any of our games and do that. So it's open, it's free. So you're welcome to go and play around with it and use that as well.
Thank you.
You're welcome.
Well, students, thank you for the questions. Dr. Wolbrink, thank you so much for taking the time to speak with us today. There are many thank you messages for you in the meeting chat. We really appreciate all you do and the incredible work you've done, and we wish you the very best.
Well, thank you all. And I am so excited to see what amazing work each and every one of you will do as well. I mean, just the fact that you're all here in this course, aspiring to do the work that you do, I have no doubt that I will be seeing all of your names somewhere doing amazing work. So I wish you all the best and can't wait to see what amazing things you do.